Does hyoid suspension surgery stop snoring? Have you ever wondered if a surgical procedure could put an end to snoring? Today, we are discussing hyoid suspension surgery and its role in treating obstructive sleep apnea, or OSA. This surgery is designed to address airway blockages that lead to snoring and breathing interruptions during sleep. Hyoid suspension surgery focuses on repositioning the hyoid bone, a small U-shaped bone in your neck. This bone plays a key role in supporting your tongue and airway structures. By securing the hyoid bone in a more forward position, the surgery aims to reduce the chances of airway collapse while you sleep. So, does this surgery actually stop snoring? The answer is that it can significantly reduce snoring for many individuals. However, the effectiveness of the surgery can vary based on your unique anatomy and the severity of your sleep apnea. One of the main goals of hyoid suspension surgery is to stabilize the hypopharyngeal airway. When the hyoid bone is advanced forward, it helps prevent the airway from collapsing during sleep. This stabilization can lead to a noticeable reduction in snoring caused by airway obstruction. Studies have shown that the success rates for hyoid suspension surgery can range from approximately 17% to 78%. On average, the success rate is around 60 to 67%, especially when this procedure is part of a multilevel surgical approach for OSA. Success is often measured by a significant reduction in the apnea-hypopnea index, which indicates the severity of sleep apnea and, by extension, the level of snoring. Hyoid suspension is often performed alongside other procedures, such as uvulopalato-pharyngoplasty or genioglossus advancement. This combined approach tends to be more effective than hyoid suspension alone, particularly for patients with multiple areas of airway obstruction. The surgery itself is minimally invasive. It is typically done through a small incision, which means a quicker recovery time and less post-operative pain compared to more invasive surgeries that directly affect the soft tissues of the tongue base. In fact, if complications arise, the procedure can be reversed. However, it is important to note that hyoid suspension surgery may not completely eliminate snoring for everyone. This is especially true for those with severe obstructive sleep apnea or blockages at multiple airway levels. Therefore, careful patient selection based on anatomical evaluation is essential for the best outcomes. Since snoring occurs due to the vibration of soft tissues caused by narrowed airways, improving airway stability through hyoid suspension can lead to a reduction or even cessation of snoring in many cases. However, if other areas of the airway remain obstructed, some snoring may still persist. In summary, hyoid suspension surgery can be an effective option for reducing snoring and treating obstructive sleep apnea. By stabilizing the airway at the hypopharyngeal level, it often leads to improved sleep quality and overall airway function. While it may not completely stop snoring for everyone, many patients experience significant improvements.